Welcome to the Nystagmus Network Virtual Open Day 2020. This presentation is called Visiting a High Street Optometrist with Jayshree Vasani and Sarah Arnold, and I'm Sue Ricketts from the Nystagmus Network. Hello Sarah, hello Jayshree.
Hi there.
Jayshree, would you like to introduce yourself?
Yeah, sure. No worries. So my name is Jayshree Vasani. I'm a dispensing optician. I work in high street practice. I'm an examiner for my professional body. I'm a sessional optician at the RNIB charity, and I am also involved in continuing education and training for my profession.
Thank you. And Sarah?
Hello, my name is Sarah Arnold. I am an optometrist. I've been qualified for about 25 years from City University in London, and I work in the south of England in an independent practice. My career has taken me through working in hospital setting when I was in Bristol at the Eye Hospital, into teaching in academia, and also travelling all over the world. More recently, I have stopped teaching, but I am involved in continuing education.
Lovely, thank you. So the reason we've asked you along today is that we've had a lot of questions from members of the Nystagmus community about what happens when they are discharged from a hospital eye clinic. They then need to go and find a high street optician, and they have quite a few questions relating to that. So, for example, they may have been told that there's nothing that can be done with their nystagmus, so why go to an optician? They may have been advised to have regular eye tests. Why would that be? They may be worried that they might be sold glasses that they don't really need. They might be worried that people at the opticians don't really understand nystagmus. They might think that glasses makes your eyes lazy, or they might think the opposite, that wearing glasses will actually make things worse. So how would you answer those questions?
Gosh, that's a lot of questions, Sue.
It is.
And I can completely understand that, because when you have been in a hospital setting for quite a period of time, you know the process and you feel safe, you're looked after, you know your specialist, you know the routine. And then when you're set free from that and you're released from being in the hospital, I think there's going to be natural concern over why. Most people don't need to be in the hospital environment when all the things that have been done, that the hospital can provide, have been done, and it's just a question of having regular eye checks and keeping their spectacles up to date. So at that point it's appropriate for them to be discharged from the hospital, and it usually coincides with the end of visual maturity, so around 8 years old if the prescription is stable for children, but it could be as late as 16 depending on when the prescription stabilizes. You feel like you're not quite sure where to go, so the best thing to do really is to shop around, work out what it is that you need for you. So and then if you can, it's difficult at the moment with coronavirus, but if you can, visit some optometrists, meet them, see what the front of house is like, meet the reception staff, ask about how much time you have in a sight test. Are they used to dealing with people with nystagmus? Do they have members of staff who've been there for a long time? You might want to establish a relationship with an optometrist rather than lots of different people, because you want the security of knowing that somebody gets to know your eyes. So those are important things to ask when you're choosing your optometrist. But basically it's about visiting somewhere that feels right for you, maybe can meet your accessibility needs if you have any, makes you feel that you can trust them and that you're comfortable and that they're there for you, and that will be different for every person. I think it's also difficult if you've been told that nothing can be done. That doesn't mean that nothing can be done for your vision necessarily, but nothing can be done for your nystagmus. Or it may be that unfortunately, if nothing can be done for your nystagmus, that you assume that spectacles are no longer suitable. And the thing is, as we get older, our eyesight changes. That's a natural thing right from birth all the way through childhood, all the way to old age. So our prescription never stays the same. So every few years it will need updating. And because it doesn't stay the same, you need to get your eyes checked so that if you need spectacles and contact lenses or magnifying aids or even non-visual aids, that those changes are made at the right time for you so that you get the best out of your eyes. You might not be able to read more lines down the chart, but you might be able to do the task you want to do for longer because you've got the right spectacles on. So that's really important. And that's the same for anybody really, regardless of whether you've got nystagmus or not. But for people with nystagmus, they get very tired eyes, very variable vision. And so they may feel that the optometrist doesn't understand that. So go and ask, do you deal with people with nystagmus? Because if they don't, they will say to you, I'm not very familiar with that. It's beyond my sort of competence really, but the lady down the road in the other optician, she sees a lot of patients with nystagmus and you might be better going there. So, you know, we're pretty good as professionals at naming what we are interested or good at and where you can find somewhere else to go. I think that's really important. You may not know that. So one of the other questions that you mentioned was about being sold glasses that you don't need. That just doesn't happen in optometry. We're highly skilled, highly professional, registered, we're regulated by a professional body. You're not going to be sold a pair of spectacles you don't need. That just isn't going to happen. And glasses are not there to make your eyes lazy, but you will notice when you take your glasses off that perhaps things are blurrier. It's not because of the glasses, it's because you've got an immediate contrast. You can see that with them on, things are a bit clearer. When you take them off, things are a bit blurrier. Some people think that's making their eyes lazy, and because things change as we get older, unfortunately, it's sometimes easier just to blame our spectacles that things have got a bit worse. But that's a natural part of aging, and that's, again, regardless of whether you've got nystagmus or not, that happens to all of us. So even us three sitting here, all in our spectacles,
Yes.
we'll all be experiencing that. So really the things I think are really important, find somewhere where you feel comfortable, where you can discuss your needs, where they may be able to give you more time. They're flexible about that approach, where you're going to see the same person every time if you want to, where they might have glasses that you like the look of. You know, Jay, what else have you got to add on?
I think the important thing there, Sarah, is that the mystery shopping element is important. And, you know, with the current situation of COVID, it might be a bit more difficult, but, you know, lots of optometrists are triaging patients on the phone. So there's nothing wrong with asking on the phone. You know, I just wanted to ask a little bit about you guys and what you do and, you know, how you could help a person with nystagmus and see what the response is. The important thing really to consider is that you remember you want to, as you had that relationship in hospital with people you trusted and you know that they would do the very best for you, you have to try and find that same relationship in the high street. Yeah. And, you know, if it is the case, as you said, Sarah, that maybe I'm not that, you know, familiar with patients with nystagmus, part of being a professional is referring to a fellow professional who is. Okay, that's part of being a professional, that you can say, hands up, you know, I'm not really that, you know, I know about it because obviously that's part of our core syllabus, but actually if you want somebody who's a bit more of a specialist, there is somebody else I can recommend. And that's the key thing, to find those people who actually want to, you know, help you and look at you holistically as a whole person, not just the condition.
Now, Sarah and Jayshree, you've been talking about optometrists, but
That's right.
when we say we're going to the opticians, so what's the difference between an optician and an optometrist?
Okay, yeah, so that's a common sort of question that we get asked. A dispensing optician is actually an eye care professional, as is an optometrist. Okay, when you go to the optician or the optometrist, the person that actually tests your eyes, looks at the back of the eye for your health issues, any health problems, any health conditions, because you can see early signs of things like diabetes, glaucoma. Okay, just because you have nystagmus, it doesn't mean you can't have diabetes. People think they've only got one condition, then that's it. Lots of times we get people going, I don't need to go back to the optician. They've told me nothing more can be done, but there are other things that could be developing. So it's really key that, that the optometrist can see early signs of disease happening in the eye. And the eye is the only place in the whole body that you can actually see blood vessels, okay, without cutting your skin, okay? So you've got to really think about it. If you have a bleed in the eye, the optometrist should be able to look at that and say, okay, there's something going on. So it's key that you actually see the optometrist for the eye health and the prescription. That is, that's part and parcel of what they do as well. And they're also responsible for things like referrals, further treatment, all of that side of things. Once you come out of the room and you actually have the piece of paper with all the numbers on with your prescription, the dispensing optician is responsible for making that prescription up to the very best of the ability. Sarah's taken a long time to work all these different things out for you, to work out the best prescription. But actually, if they're not made up correctly, are you getting the best out of it? Okay. So the dispensing optician is charged with that duty to help make sure that the lenses are made to the best, that you can get the best vision, and also the frames are the most comfortable. They feel good, they look good, you feel positive in them. All of those elements are part of a dispensing optician. We also have a sort of specialized skill in pediatric dispensing, so for kids, okay, because kids' faces are changing as they're growing, so it's important that they're seen by a qualified dispensing optician. And similarly, low vision as well. Again, somebody with low vision may need different advice and care and support. So again, it's better to go and see a dispensing optician on that front. An ophthalmologist is a person who's actually a doctor and then specialise in ophthalmology. Okay, so that's who you see in the hospital. They're taking care of the person where the optometrist has decided to refer on and say, okay, this person needs further investigation, diagnosis and treatment, all of that side of things. Orthoptist is the other one, and the orthoptists are generally based in the hospital, and they work primarily to do with the binocular vision, the way the two eyes work together, okay? And that's really important. If your eyes are working together, they're working well, the vision that you get is coordinated, so that's really important too. Generally, they do, sort of specialize more in pediatric, but also they might work with somebody who's had a stroke maybe and is having difficulty with the vision there. So the orthoptist, again, is a key person in the hospital generally, but the important thing is that all these eye professionals collaborate to make the eye care journey the best for the patient. So it's trying to figure out what the whole sort of eye care journey is for the patient. And also, if you're not sure about who you're seeing, just gently ask and just say, can you explain your title? Are you an optometrist or are you an optician? So you know who you're talking to. Because sometimes people are a bit worried about asking. There's nothing wrong with that. Nobody will feel offended. Most of the time people might wear a badge, but you might not see that badge. You may feel a bit shy about asking, but it's good to ask. At least you know who you're speaking to and what their roles and responsibilities are. That's key, really. Have I missed anybody out, Sarah?
Yeah, contact lens optician. Contact lens opticians. So a contact lens optician, you don't get them in every single practice, but mostly they are dispensing opticians who have gone on to do further training in contact lenses, and they are specialised in turning the optometrist's spectacle prescription into an appropriate contact lens prescription, contact lens fit, and they often deal with some really highly specialised, complicated contact lens fits, and they are a really good addition to a practice if you've got a good contact lens optician. Optometrists can do that too, but I would say in the last 20 odd years, contact lens opticians have been much more at the forefront of contact lens practice. So you may see a contact lens optician for contact lens fit who can't examine the back of your eyes or give you advice on your binocular vision like your optometrist can. So it's just about understanding the differences between those roles, really, and the teamwork that goes into that. So when you've been in the hospital setting, you've had a team of people looking after you. It's no different in the high street optometrists where you have a different team of people. It's just about understanding those different teams.
So anyone can go and see an optometrist?
Anyone can go and see an optometrist. Yeah.
Absolutely. And Sarah, the other thing you were saying, which I think we were talking offline, is that sometimes people feel, talking just generally, anyone, people think maybe a person with a learning disability can't go and see an optometrist because they don't know the letters or they're not confident or whatever. I think it's really important to emphasize that disability, no one is too disabled to have an eye examination. There are different ways of, if you can't read the letter chart, you don't know the letters, optometrists are very skilled at having lots of different ways of working out a prescription and looking at the back of your eye. So that's really key message to put forward. People sometimes worry about that, you know, thinking, oh, well, they don't know the letters, they might not be able to say this, or they might not be. It's really important that you remember that actually every person has the right to an eye test, every person.
Yeah, yeah. And I would say more commonly, we'll see patients from about 2.5 to 3 years and older. That's when I start seeing people regularly, but I can get babies as young as 6 weeks brought in to see me, and because mum and dad have noticed that they've got shaky eyes, or they've got something wrong with their pupil or an eyelid, or the eye is turning in, and then I'm their point of contact to refer to the general practitioner, who will then refer on to the ophthalmologist. And that relationship between specialties, between the general practitioner and the ophthalmology and neuro-ophthalmology, is very fluid. There are very few barriers these days. That maybe 30 years ago it was a bit trickier, but we have very good relationships, and there's a lot of flow of information between the specialties. And so it's very easy, if you have been discharged from the hospital and you're getting difficult symptoms, or you want to go back, maybe you've decided you would like to have some registration or some genetic testing, or you just want your ophthalmologist to check you again, your optometrist would be able to refer you back quite easily back into the hospital system. That's not a problem.
Brilliant, thank you. You briefly mentioned registration there, Sarah. That's something that I think a lot of people may have a few questions about.
Registration is completely voluntary. So when you have to meet certain classification guidelines in terms of visual impairment to be registered as sight impaired or severe sight impaired. So by sight impaired, you might know that in the past as being partially sighted. We don't use that terminology anymore. And severe sight impaired might have been known as being blind. What a lot of people don't understand is when you have a severe sight impairment, you actually do quite often have some residual vision, but it isn't that useful. With people who are sight impaired, they have more useful vision, but they usually have a permanent loss. So it's not really appropriate to be registered if you are receiving treatment that's likely to restore your sight to normal levels, if the ophthalmologist is anticipating that you're going to get better, or if you've got one good eye and one lazy eye. As long as the good eye is perfectly good, that's not appropriate. You can't be registered as sight impaired from that point of view. But often people with a permanent eye problem that cannot be fixed or is reducing the vision are eligible, and nystagmus is one of those in some cases. In some cases, there is a vast variety of causes, as I'm sure most nystagmus patients are aware. It's very diverse. It's one of the most diverse conditions in terms of cause. Not everybody is appropriate for registration, but if they are and they're interested, they can ask their ophthalmologist. If they've got as far as their optometrist, because the ophthalmologist hasn't offered them registration, again, the optometrist would refer back to the hospital. We know what the criteria are, so if we think that criteria is met, we'd refer back and the ophthalmologist would check and can register the patient as sight impaired or severe sight impaired. Registration is completely confidential, so you don't have to walk around with a badge that says I'm sight impaired. You don't have to tell anybody, but what it does give you access to is support, and particularly from the sight loss services, social services in your local authority. So that's really important, and they have many resources. You might get to see an ECLO, that's an eye clinic liaison officer, who can again give you lots of support. Many people with nystagmus do decide to join the register for sight impairment and then worry about the impact on driving, because you cannot get a driving licence if you're registered as sight impaired or severe sight impaired. That probably doesn't surprise you. If you're registered as sight impaired, so partially sighted, you can, and you meet the driving criteria, so you have to meet the driving criteria, you can apply to withdraw from the register so that you can drive. So that little grey area, I don't know if that clears that up. I know that's something that people ask me a lot.
Yes, me too. That's much clearer. Thank you.
I think, Sarah, you were saying about checking every time, you know, in terms of you feeling confident about driving. That was quite an interesting little conversation we had.
Oh, we did, yes, when we were talking offline, absolutely. Whether you've got nystagmus or cataracts or macular degeneration or whatever it is that's causing your vision to be a bit borderline for the DVLA driving standards, and we're talking in the UK here, we're not talking globally because it's complicated. We're certainly not going to go into other countries, but in terms of the UK driving standards, they're very rigid and they are upheld by the law. So where someone is borderline and I can't get their vision better with glasses, or they have good days and they have bad days, I make it very clear. First things first, you need to have an eye test every year so that we can make sure that you're still just meeting this standard. Second thing, don't drive when you're having a bad day or you're under stress. Avoid the rush hour. Don't drive in the fog. Don't drive at night. That sort of thing. Always check before you start the engine that you can still see clearly a number plate at the set distance. If you get in the car and you think, oh gosh, my vision's not very good today, don't turn the engine on. Just don't drive that day. And that applies to nystagmus, I think, probably more than a lot of conditions, because stress and tiredness will affect the level of vision and how well you're able to see for. So, of course, if you're in a really stressful situation and you're not seeing very well and you're having a bad day, getting in the car in those stressful circumstances is not going to really give you the best vision possible. So always self-check. If you're borderline, always self-check and be responsible about that.
Thank you, Sarah. So one question I get asked a lot is, what's better for nystagmus, glasses or contact lenses?
Oh, so that's quite a broad question. The first thing that I always say to people, regardless of whether they have nystagmus or not, is that you should always have spectacles as backup and contact lenses as an addition. It's an and, not an either or. Okay, so it's an and. Contact lenses are brilliant for a lot of people, particularly with nystagmus. If you have astigmatism, that's suitable for contact lenses that help astigmatism, and there are many, many types out there these days, or you have a null point that's tricky, then contact lenses are great. But you do find with nystagmus often that the patient becomes more aware of their contact lenses over the course of the day. They can get tired, so they need spectacles as backup. So for sport, absolutely brilliant. Maybe for driving, actually, contact lenses are good. They often get better visual acuity, so how many letters they read down the chart in a contact lens, or a pair of contact lenses even, than in their spectacles, which is interesting. We can come up with tinted contact lenses as well. So some people, if they have albinism, for instance, tinted contact lens might be useful, or you can just put shop bought off the peg sun specs over the top of contact lenses, so you don't have to have prescription sunglasses always. It gives you a bit more flexibility, particularly for those who are a bit more fashion conscious. So there are lots of advantages to having contact lenses. Very high prescription astigmatism will often do better in a more rigid lens. People worry about feeling that on their eye. That's down to the individual. They're still very much fitted as a standard, although people prefer soft lenses. But that's really because they don't know how they'd cope. And then once they find a rigid lens isn't too bad, and the vision is so much better, often the improved vision overrides the initial couple of days of discomfort that they have to start with. So I would say you can't answer that question for every single person. It's an individual basis. So it's not just because your friend John hates contact lenses doesn't mean that your friend Jane is going to hate them too. So it's different for everybody, but you need both, basically. And the other thing, you can't have contact lenses on their own if you require prisms. So some people require prisms to help them to coordinate the eyes better. You can't have a prismatic contact lens. So prism is a special type of addition to a spectacle lens to help the eyes turn a certain way, particularly used in squint, but sometimes to help pull the eye muscles that converge the eyes in for nystagmus. So that's not going to help. It's a very broad question, but I would say always give them a go. I'm a really big advocate of trying them, because if you don't try, you will never know. And set your expectations. So if you want to have a 12-hour day in contact lenses and you have nystagmus, that might be biting off more than you can chew. But if you want them for 4 or 5 hours and are happy to use them for car journeys, sport, that sort of thing, brilliant. You know, they're a good addition.
I think I would echo that, so, but more importantly, I would say it's part of the optical wardrobe. Just have people, just as people have, you know, different shoes for different things. You know, you've got a regular pair of shoes, and yes, you can use those to the gym, okay, but you know that pair of gym shoes, you perform the task better. Dancing shoes perform the task better. You can do it in your regular shoes, but the shoes are actually made, customized. You know, they're actually made for the purpose. So there's nothing wrong with having an optical wardrobe. And, you know, you could be cynical and say, yeah, the optician would say that, wouldn't they? Because they want to sell you more glasses. The important thing to recognize is that if there is something that can give you better vision in a different pair of glasses, why wouldn't you do that? Make life easy for yourself. Make the vision less taxing for yourself, and actually, you know, give yourself options so that you can actually make the best of the vision in different situations. Okay, it's about thinking, you know, that the holistic approach and making sure that people, and that goes to anybody with eye care, you know, sort of needs, if you like. It's not just people with nystagmus, anybody. Think about the optical wardrobe. You know, glasses are the first thing that somebody sees on your face, okay? And you wear them day in and day out. And I often get a question, you know, as an optician, how many pairs of glasses do you have, you know? And I sort of say, well, yeah, you know, I've got glasses for this, I've got varifocals, I've got glasses for close vision in terms of, you know, seeing very small print, I've got sunglasses, I've got, and people go, oh, well, yeah, but the important thing to recognize is that whether you decide to choose to go for those glasses, that's up to you. But you have to ask the questions to know the options, okay? And think about whether that need is there. It may not be there that day. You might have seen Sarah today. She might have recommended 3 pairs of glasses. You've gone ahead and got the varifocals today. Great, okay? But then she did say that, but listen, Jay, if you do find that actually you're doing a lot more computer work, we can supply you with different glasses that are actually optimized for the computer. You can see your computer much better. If you decide you want to go for those, come back to us. We'll have a chat about it and see where you go from there. So it's recognizing that you can do different things, but there are lots of different lenses available, and that's where a dispensing optician will use their expertise to guide you through and make sure you understand what's going on. You know, how many pairs of glasses have you got, Sue?
I've got 4 pairs of glasses.
There you go. There you go.
Yeah, me too. Yeah, 4 pairs. Very good. I think something that people maybe not understand is how optometrists and dispensing opticians absolutely love their jobs, and they love getting the best for the patient, the very best solution for the patient. They work really hard to get the best solution for the patient, and that's what makes them go to work day in, day out, is the fact that they are doing their best for the patient. The patient walks away able to see better, feeling more confident, feeling like they've had a good service, having been looked after. And that is really what our profession is all about. And that integration between the dispensing optician and the contact lens optician and the optometrist and the ophthalmologist, it's just such a nice relationship. So patients really should be very confident when they go to choose their whoever it is that they choose to go to. The most important bit is the relationship, that trust relationship, but they're confident they're going to somebody who wants to do their best for them.
A pair of contact lenses can enhance somebody's life to an amazing extent. You know, it really can open somebody's sort of vision up into different things. It can give somebody confidence. You know, a really nice pair of glasses, if you've always thought of that, you know, maybe you've always had NHS glasses in the past or whatever, you know, in terms of, you know, when you were a child, and you've always had a thing like glasses. If we actually get you into a pair of glasses that you feel confident with, it can make a massive boost to your confidence in terms of what you do, how you see yourself. So it can be quite life-changing. So it's important to find the person you trust to do that with. I think the other thing you were there's one more question you had, and was that about varifocals?
It was, yes, you talked about varifocals, and we do wonder sometimes whether varifocals are appropriate for people with nystagmus.
Yes, yeah. So I would say that varifocals are a lens that can work, because if you think about it, if you had 2 separate pairs of glasses, you had a pair for distance and a pair for reading, okay, that's 2 separate pairs of glasses to carry with you all the time, to think about, you know, which pair you're wearing, all that sort of stuff. So varifocal gives you an idea that that's one. Somebody said to you, how about I give you a lens where you can do both things in one go, 1 pair of glasses that you just put on and you can do it. And you go, yeah, I'd have a bit of that. That's great. Yeah, I think that would work for me. So as with anything, okay, you're trying something new. If there is a reason to get forward and to move forward, you will adapt. You will cope with what comes along with that That's scenario, okay? So if it does require a little bit of adaptation, that first couple of weeks of you know, recognizing what the vision is like, the vision's a bit different, that's fine, that's okay. And that goes for anybody with varifocals, with nystagmus, without nystagmus, okay? So there has to be a reason for you to go forward with that lens in that first particular point for varifocals, right? That's one thing. And then two, the important thing is to give feedback to the optometrist or the optician if you're having difficulty with varifocals, okay? So if for some reason in that first 2 weeks you feel, oh, something isn't quite right. We had a lady come in and all she needed was a slight adjustment on the way the glasses fitted, and it made it so much better. The important thing is the feedback actually is key, because if you come back to the optometrist or the optician, they can figure out whether you're actually genuinely having a problem with a varifocal, or actually is it just to do with adaptation, a bit more reassurance, whatever, all these sorts of things. And rest assured that if it isn't going to work for you, you have to make sure when you go ahead with that purchase of the varifocals to say to somebody, you know, to say to the eye care professional, what happens if I don't get on with these? Ask that question. Put it out there. Say, what happens if I don't get on with these? And see what they say. See what the reply is. We will sort you out with something else. We will do this. We will do that. So you know exactly where you're going. People worry about the costs of things, and I get it. You know, it's fine. With nystagmus particularly, the important thing to consider is where is your null point, okay? And also to be open to trying something different. Sarah, we were talking about the null point, weren't we?
We were. Yeah. Your optician will test your eyes in your null point, where you get the best vision. So your spectacles need to be made up in your null point. And the only tricky bit with varifocals or any reading spectacle actually is like a bifocal, is if your null point is very different for reading to when you're looking in the distance. So if that is very variable, probably it's not going to work well in a varifocal. So that might be the odd exception, I would say. Yeah. But all my advice would be always to nystagmus patients is, you know, your null point is where your vision works best. That's where we will try and adapt everything for you, and you will spend your life and your lifestyle around using that null point. So it has to be incorporated in everything you do, and that includes your spectacles.
So the answer is yes, you can go for varifocals, just to make it clear, but important that the dispensing optician understands where your null point is and what you want to achieve from the varifocals. Again, that same question again of what you want to achieve. You know, what is it you want to be able to get to at the end of wearing that pair of varifocals successfully? Okay, and talking about null point talking about, I was just thinking about it, and we were talking about children and where they sit in a classroom. You know, things like that are important. You know, where they sit in the classroom to help make sure they get the best vision with the null point. Maybe the teacher isn't quite aware of that. Maybe the teacher isn't quite aware that it's important that, you know, Jay sits at this particular desk in a classroom, or the setup of the classroom, or maybe having a tilting desk, which makes it a little bit easier, or maybe having an iPad so that basically if the teacher's writing on the whiteboard, you know, the child with nystagmus has an iPad next to them so that they can follow what's going on. Having their own sort of, not sharing notes either, because again, that could be at the wrong place for the person with a null point. These sorts of little sort of things are important, but key for a patient in terms of getting the best vision in, say, a lecture setting or a school setting or something like that. Thinking about non-optical aids, if you like. We're talking about varifocals and optical aid. Non-optical aids like a typoscope or the Dolphin Reader app from RNIB. There's so much tech out there, and there's so much sort of little things that can make a difference. So again, if the optometrist, you know, or the optician isn't that aware, important that they actually get that information. We can look at the webinar series that you guys commissioned for training the professionals. And that was a great series, and I think that again is a myriad of information for people if they're interested in that side of things as well.
Yes, thank you for mentioning that, Jayshree. Both Sarah and Jayshree were very much involved in our series of webinars for eye care professionals, and these are available online if anybody would like to watch them. If you'd like the link, please contact us at the Nystagmus Network, and we'll make sure you can see those. Okay, thank you very much, Sarah and Jayshree. I think you've answered all of our very tricky and very searching questions, so thank you very much for that. Thank you for your time today, and we will have lots more questions for you in the very near future, I'm very sure. Thank you.
Thank you for the opportunity.
Thanks a lot.